in society, discrimination, and the impact on discrimination, because I would like to broaden a bit the scope, as violence in society might have an impact as well on cognitive health. And maybe in all these types of violence, we included often mental health, but we tended to forget cognitive health. So we all know that violence is related with higher mortality and morbidity. We know that violence is associated with mental health systems, but we have some question marks whether violence indeed is as well associated with accelerated aging, and accelerated aging with cognitive health symptoms. The rationale behind it is very famous papers from Bruce McEwen and Teresa Seaman about allostatic load, and she found out that, or both found out, that even low level, if we call it low level, types of violence are associated with changes in biomarkers, and investigating in large cohorts might be necessary, the changes really in the biomarkers related to the exposures in violence. In the scope of these studies is one study which shows that the mean score of allostatic load differs between white and black persons in the United States, and that the difference is quite high, at least 3 years, and the allostatic load differs accordingly as well between white and black persons. So my talk today is first about a little bit of the background. What do we know? Then I will present some more details about the studies on discrimination and cognition, and on violence at the workplace and mental health. And finally, we can discuss about next steps, maybe transcontinental next steps. So what do we know? We know that discrimination can be defined by the World Health Organization as any distinction, exclusion, or preference made on the basis of race, color, sex, religion, political opinion, or social origin, which has the effect of nullifying or impairing equality of opportunities. This is included with very different types of exposures, such as buying a home or purchasing a car, renting an apartment. All these factors are related whether people are treated equally, receiving a promotion or getting the opportunity to get an insurance, obtaining bank loans. Everything is an indicator of discrimination, and the experiences of this discrimination may in fact be a type of violence. There are some studies showing that discrimination has an impact, such as that discrimination is related to oxidative stress and to higher mortality. Likewise, discrimination has shown to be associated with cardiovascular diseases, with the metabolic syndrome, and as well with depression and anxiety. Today, we are interested in the cognitive function. Cognitive function has different segments of cognitive functioning, such as working memory, cognitive flexibility, and inhibitory control. So all these different types, how the brain, how the memory is working. And we are lucky that we had this data in the MIDO study. The MIDO study is a longitudinal study in the 48 states of the United States. And in this study, we have data on cognitive functioning. We have data on biomarkers, such as the allostatic load. And in the Milwaukee sample, we have as well data on mental health and on different types of mental health symptoms. Then, and at the moment, there is a third wave. Of course, we do not have the data already, but in this data, we have a rich treasure of finding and of having the possibility to identify trajectories of mental health and trajectories of exposures. So, the aim of the specific study which we did on discrimination and cognitive functioning was to identify and analyze changes in the executive functioning and in the episodic memory over 10 years in men and women. I don't know whether you are familiar with the definition of executive functioning. Executive functioning basically is related to be able to set goals and to perform these goals and to perform steps in direction of these goals. Episodic memory is a memory which is a short-term memory and which helps for school success, for success in universities. So it's a memory related to be able to remember things which have been learned over a longer period. So we wanted to identify trajectories, we wanted to identify potential changes, and we wanted to identify discrimination, whether it's prevalent or not, and we wanted to identify the changes in discrimination. And finally, whether discrimination in trajectories of discrimination have an impact on executive functioning and on episodic memory, of course, separated by gender. Already I said it is a prospective cohort study. The participants are non-institutionalized population living in the 48 states in the United States. We used instrument for measuring cognition, the so-called B-TECT instrument, which has been designed to measure executive functioning and episodic memory. We measure discrimination and, of course, the sociodemographic variables, which we are always measuring, such as age, gender, education, and income. We did some descriptive analysis and looked for trends. We did multivariate linear regression analysis and, of course, sensitivity analysis, looking whether the effects changed across the socioeconomic status of the participants. First, we found some trends in discrimination. Discrimination differs according to the age group. The discrimination in work is changing, and the younger parts of the population are more exposed to discrimination compared to the older parts. But the discrimination in society remains to be pervasive, even in older ages. So we found some differences, but we found as well that these associations are prevalent. This table is very busy, and it's only to show you that we have try to identify how executive functioning and episodic memory is behaving across the different groups. Maybe to highlight, we found the things which in a way we already knew, that people with more education have better executive functioning, and those with a higher income have a better episodic memory. Nevertheless, these findings differ a bit between men and women, and we found that especially the lower income are affected by the effects of discrimination. We identified, or we separated discrimination events from daily discrimination to identify whether the quantity and the duration of the exposure has an impact on cognition. And here we can see that indeed the daily exposure to tiny little discriminating events has a small but nevertheless a significant effect. What might be the mechanism behind it? We know that there are differences in the different population groups in telomere lengths, and the telomeres are sequences of the DNA at the end of the chromosome, and telomere length is viewed as an overall marker of biological aging. And in the study of biomarkers related to the minor study, it was found that Black women had shorter telomeres than white women, and likewise that Black women had an accelerated.
Jutta, sorry,
Yes?
like, are you moving the slides or you are still in the Midas Studio
Moving the
slides?
slides. I'm moving the slides. Can you see
Because
it?
I only see the Midas Studio like frame and the.
I showed you all the numbers.
Oh no, we are not seeing that. I don't know why. Maybe can you turn your camera off? Because maybe it's just the internet that is failing. And try to open and close again the PowerPoint and see what happens.
Sure.
Please,
Thank
sorry.
you. No, because I'm showing you all the time. I'm showing you the numbers.
Oh my God, sorry. I just try to close and open again the slides, and because we are still seeing only data of the Midas study and it's the figure. No, it's not happening anything.
No, I closed.
Nah, it's the same figure. That's so crazy. Sorry.
No.
It's Teams. Teams is always crazy.
Teams is sometimes, Zooms is much better, yes. But what do you
I
see
know.
now?
The same figure. I don't know why.
Because I closed.
Yeah, we just see the same thing. ¿Alguien sabe, entre ustedes, alguien sabe qué se puede hacer? Porque yo no tengo la menor idea. Jennifer, que está por ahí.
Entrar y volver a salir y entrar, pero...
Dejar de compartir pantalla y volver a compartir.
Okay.
Now?
Yeah, now we are not seeing anything, but now you have to try again to share the screen.
Can you see it now?
No.
This is crazy.
ask Jan to help you.
So my camera is off.
Yeah, I can see you are connected, and that's it.
And now?
Negative.
Parece que ya ahí está compartiendo, pero no vemos nada todavía, pero ya parece que va a salir.
Okay.
Y la presentación tienes, Alexa, tal vez tú puedes compartirla.
Voy a ver si sí me llegó. Profe Carlos, se la voy a enviar a usted. Por Carlos. Listo, ya se la envié el profesor Carlos, porque yo no puedo compartir.
Pero me dice que estoy compartiendo.
Es que se ve, now I can see is black. Maybe try to open the slides. Now is no.
Y si apaga la cámara, de pronto el internet no le da para tener las dos cosas al mismo tiempo.
She already, ya apagó la cámara, perdón.
Tal vez si de verdad es related to the internet.
No me ha llegado la presentación, ya me la mandaste.
Sí, señor.
Dios mío. Qué pena, no me llega todavía.
¿He enviado a Alexa la presentación?
Sí, yo
Me llegó espérate que sí, no sé por qué me llegó a spam, pero bueno, ya.
Ok.
Dale, ya la abro.
¿Puedes verlo, no, ahora?
El profesor Carlos la va a compartir.
Sí.
Sí.
Ya.
Súper, ya.
Ya ahí se ve, Yuta. We can see now. What do you know? We can see on a slide that say, what do you know?
But this is no. And can you see now the table?
No.
It's men and women? No.
Está muy
Okay,
lento.
maybe it does not work.
Intento compartirla, yo desde acá ya la tengo.
Sí, profe, porfa.
Bueno, dale un momentico, ya puedo hacerlo lo más rápido que pueda. A ver si me deja.
Perdón por los problemas. Yo.
Dios mío. Bueno, voy a... Ahí lo pueden ver ahí.
Muy bien.
Sí, profe, lo podemos ver. Entonces yo
Bueno.
creo que muevas hasta la diapositiva que dice qué sabemos.
Sí.
Y de ahí.
Es que no sé. Ok, ya, listo. Bueno. Aquí, outline. Oh, no, eso ya los...
Esta.
Ella ya ha
Eso.
pasado por esto.
Sí, ok. Sí,
Que tiene animaciones también, entonces, listo. Aquí vamos
Eso.
acá, aims. Aquí nos quedamos, ¿cierto? Los objetivos del estudio.
Sí, ok. Sí. Yuta.
Sí.
Ok. You can speak now en 3
Dime,
slides.
Alexandra, si quieres, hasta dónde avanzamos con ella, porque de pronto, pues esto lo explicó ella, pero no sé si vamos directamente a los
Sí.
resultados mejor para ganar tiempo.
Sí.
que repita esto.
sí.
Sí, sí.
Bueno.
Sí, vale.
Ok, dale,
Okay,
adelante. Go ahead.
Jumping to the results, thank you for saying that you didn't see anything. Me disculpe, you know, I don't know why. So we can see the results, which can show that there are trends in discrimination related to age, which means that discrimination is diminuing and the older parts of the population suffer less from discrimination at work, which is quite logical compared to the younger parts of the population. But nevertheless, we can see as well that even in the older age groups, discrimination at the society level is still prevalent. Next slide, please. We know this slide is very busy and we don't talk about the details. Only I wanted to show you that indeed we can identify different changes in the executive function and in episodic memory by gender. And we can see what we already know, that those who are better educated had the opportunity to go to school or to college, have a better executive function compared to those with less education, and those with higher income have a better episodic memory compared to those with lower income. Likewise, we can see, I don't have this table here, is that over the age groups, the executive function and episodic memory of men is declining earlier compared to men. Next slide, please. We can as well see that we have an impact of discriminatory events in the family, both for men and for women. Next slide, please. And we can see that social stress, discrimination in the society, especially daily exposure to discrimination, to discriminatory events, has a small but nevertheless significant effect on cognitive functioning of the population. Next slide. Thinking about the rational why this might be, of course, we bring together the concept of allostatic load and the findings related to allostatic load with findings for epigenetics, suggesting that there are differences in the telomere length according to exposure to discriminations. What are telomeres? Telomeres are sequences of DNA at the end of the chromosome, and the telomere length is viewed as an overall marker of biological aging. Some studies found, and the study as well, that women had shorter telomeres than white women, and at a chronological age, the black women had an accelerated biological aging of about 7 years, which means that indeed the effects of discrimination have a significant impact on cognitive health. Next slide, please. Conclude, what does this part of the MIDAS study show us? That it shows that there are significant decreases in discrimination with increasing age. It shows as well as by doing cross-section analysis that work stress at the workplace is associated with decreased executive functioning and decreased episodic memory. Meanwhile, at longitudinal or analyzing the longitudinal data, we can see that stress in the family is associated with decreased episodic memory, especially higher income men, and discrimination at a societal level is associated with decreased executive functioning, especially among lower income men, which shows us that discrimination as events experienced especially by lower income men, and women have a different role. We do not have time to talk about it. Might be very interesting in the future that discrimination has different effects. So maybe let's move on to the next slide.
Profe, Carlos, se fueron las diapositivas. Okay, that's fine.
So what are the conclusions and what can we learn? We know, of course, that we need more multi-country longitudinal studies on the effects of social stress and mental health. And I think into the studies we should include not only mental health, but as well cognitive health, to bring together the different aspects of the potential impact of stress and violence, and to understand a bit better what is going on in the population. Maybe next slide. Thank you. I wanted to mention my collaborators, and of course, thank you to Kimberly and Margie and Beate Ritz and Teresa. She's the one who founded this concept of allostatic load, or one of the main figures in this concept. Thank you. Next slide. Now we go and move to the study done with Alex, violence at the workplace and mental health of healthcare personnel, which is related to the findings which we have from the Bible study, because as well we are investigating minor and physical exposure to violence and to discrimination. Next slide, please. This is not the first study suggesting that there is an impact on healthcare personnel, and there is a very nice overview by bibliometric analysis of published literature on workplace violence in healthcare personnel. They found quite a lot of publications on this topic. Nevertheless, our study is something special because we have these 3 countries and we are investigating workplace violence at a specific point in time during the COVID pandemic. Next slide, please. What is the MIND study? The MIND study is a longitudinal study at the moment. 2 waves included in the studies are 3 countries, Brazil, Colombia, and Germany. But these are not national representative studies, but in the case of Brazil, it's representative for one region. In Brazil, in Colombia, it is something special because you have data from all over the country. Next slide. So the questions are, how has the COVID pandemic affected healthcare personnel? And the question is, there are quite a few questions, such as, are there variations in the level of exposures according to gender? Are there variations according to countries and according to the functions in the healthcare facilities, And we are specifically interested as well in the severity of the exposure. How does it differ between these three countries? Next slide, please. The aim is to describe the exposure to workplace violence among the participants according to country and gender, and to identify workplace-related violence, including stigma, harassment, and physical violence. Next slide, please. We included stigma because of being a healthcare worker. We included harassment, verbal and physical, by a family member of the patient, and we included physical violence because of being a healthcare worker. Attacks done by patients or done by family members of the patients. So we included type of exposure and as well quantity of exposure, and segregating, differentiating between no exposure, one form of violence, and two or more types. Thank you. Next slide. So we move on to the results, and we can see that there are quite striking differences between the three countries and the level of exposure, or the age categories, sorry, to start with, differ between the countries. We can see that mostly females responded, especially in the case of Brazil. And we can see that we have highly educated participants in all countries. So these are the socio-demographics. Next slide, please. Now we move on to the healthcare facilities and to the job-related variables, which was necessary to better identify the specific types of exposures. However, we can see some differences between countries, which means that in Germany mostly, or we could reach quite a few medical doctors. Meanwhile, in Brazil, the percentage of doctors is lower. Next slide, please. Because we should see the results related to discrimination. Okay, and now come to more job condition related exposures. And as well, here we can see we have differences in the exposures related at the beginning of the pandemic to the provision of PPE. And we can see that the high-risk clinical personnel differs between the countries, and the high-risk clinical is less in Brazil compared to Germany and compared to Colombia. Next slide. Oh, we come to our topic, finally, the topic of victimization, the topic of being exposed to physical violence or of harassment and psychological abuse by family members. We can identify or we can see that the exposure to violence at the workplace is related to an increased odds of showing symptoms of depression, and the impact is quite high. We can see that the odds ratios in the different models are significant. We can see as well that females are not only more exposed to violence, but as well that the impact of exposure is higher in females. We have to do still some analyses, but the analyses are promising, which show us that during the pandemic, the healthcare personnel segment of the population was a very special one. Next slide, please. So violence against healthcare professionals was quite frequent and constitutes a source of concern not only in Colombia, but as well in countries around the world. We know that the healthcare professionals are indeed impacted by the effects of violence at the workplace, and in many countries, many nurses and medical doctors left their positions and moved on to other jobs because they simply couldn't tolerate it any longer. So we hope that our study contributes a little bit to future research in identifying need more in-depth what contributes to the exposures with final aim to effectively reduce the exposure of workplace violence. Next slide, please. So again, thank you to the collaborators, and I already mentioned the very fruitful collaboration with Alexa, but as well with Andrea. And this study, the MIND study, is embedded in a larger study, the so-called HERO study, and the principal investigators are Franco Mastroianno and Esther Sasa. So our thank you, of course, to these collaborators as well. Next slide, please. What are the next steps? Because always there are many questions resulting from study results, and I think we need to investigate better the impact of violence, including discrimination and violence at the workplace, on cognitive and mental health. We need better exposure measures for these types of violence, and especially for different types of violence. We need to understand better why the mechanisms why violence indeed affects cognitive and mental health, and to understand the mechanisms. We should not only restrict our research to national studies, but really to more international and interdisciplinary longitudinal studies to understand really better these mechanisms. We would like to know more about variations by gender, because of the female part of the population responded more to studies. Therefore, we need to know more about male participants, and we need to know more about the variations in the results related to the context, related to the historical context, and identify the impacts of specific types of violence in different societies, because societies are affected in a different way historically by violence, and whether this has an impact on mental health and cognitive health. Next slide, please. So my last slide, because I had to be a bit due to our technical problems. Muchísimas gracias. This is a picture from city of Emden, Germany, I'm coming from. So I hope that you will visit one day. In case you have questions, please feel free to send me an email. And I think now it's time para preguntas for questions. I'm looking forward to your comments and questions.
Thank you very much. Muchas gracias, profe Alexandra. Entonces, si quieres, adelante con la moderación. No sé, ahí puedes ver en el chat, en el chat cuando alguien levante la mano, ¿cierto? Se puede ver, o en las participantes. Sí.
Bueno, sí.
¿Cómo hacemos?
Sí,
¿Hacemos las preguntas en español? ¿Tú las traduces a inglés?
Si hablan despacio, Yuta entiende el español, pero si necesitan, yo les traduzco la pregunta, no hay problema. Y no sé si los estudiantes tienen preguntas, sé que tuvimos problemas técnicos, pero es muy importante que observen como dos estudios longitudinales y observen cómo incluir marcadores biológicos en estudios longitudinales. Es un buen aprendizaje para todos. No sé si alguien tiene preguntas o yo puedo hacer una mientras piensan en
Adelante.
preguntas. Yo tengo, Yuta, ¿nos podías contar un poco cuáles fueron los marcadores para medir la carga alostática?
Sí, la carga alostática is measured on different, is measured by blood markers, by, like, for example, you all know probably cortisol. So cortisol is very easy to measure. In this specific study on cognition, did not include the biological markers, because markers the analysis of the biological markers is done by another team from another university, so mainly Michigan. They are analyzing the biological markers. As you have mentioned, Alexa, if it is possible, then it might be good to include the biological markers in epidemiological studies. It is a bit expensive, of course, and therefore it's not always possible, and maybe it's even not always ethical. But therefore, it might be good to have the option in a study. That we have these longitudinal studies to provide really representative data, results from representative data, and in a smaller sample of the population, it might be useful, helpful to include these biological markers. But it takes time, and at the moment in Germany as well, there's a study including biological markers as a nested study within a study in longitudinal trajectories of resilience. But it is very difficult, as it takes on 3 hours for participants, which is a high load to be included. I'm a bit, I think it's a good point to use biological markers, but on the other hand, I don't know necessary.
Jutta, can you turn off the camera because we are losing your connection? Yeah, great, thank you. Yeah. Now we have a question from Carlos, Profe Carlos.
Muchas gracias por la presentación, Yuta. Me parece un tema muy interesante, mucho de lo que has dicho. Pues para muchos de nosotros es muy nuevo porque posiblemente trabajamos en otras áreas de epidemiología. Yo quería hacer referencia a un a un asunto que yo me he encontrado trabajando con población indígena. En población indígena hay un asunto de discriminación racial que ha estado presente en el continente americano, desde Canadá hasta la Argentina, en todo el continente, y se habla de un efecto de la colonización europea en el continente americano y cómo ese efecto de discriminación y de, digamos, de exterminio de la población indígena que sucedió hace 500 años, digamos, eso de alguna manera, ese efecto permanece en las nuevas generaciones. Hay una transmisión del efecto, de los efectos de la colonización y la discriminación. No sé si pudieras hablar un poco de eso, cómo la discriminación se puede transmitir de una generación a otra y cómo se puede, qué sabes, que han estudiado sobre ese aspecto. No sé si me entiendes o si no, profe Alexandra, si ella le explicamos mejor. Gracias.
No, gracias. He entendido muy bien y muchísimas gracias por esta pregunta, que es una pregunta muy, muy importante y viene directamente de mi corazón también, ya que estoy muy interesada en la transmisión transgeneracional y he hecho dos estudios como el trauma y la violencia se transmite across las generaciones. Therefore, thank you very much for this very, very important question. And I think indeed we should, and this is something what I would like really to mention, we should include the different contexts. So the different types of historical experiences. And you mentioned the experiences of de la población indígena. Maybe really we should focus a little bit more on the impacts of continuous exposure to discrimination and to racism. What does it make with mental health, but as well, sadly enough, with cognitive health? So if you understand more the real impact of the historical injustice which has been done to the population in some parts of the world, maybe we can better and more effectively develop some types of interventions. I'm totally with you, and there are studies on historical trauma, and we are differentiating between historical trauma and political trauma. And of course, there are hints that there are transmissions of historical exposures and of exposures by parents and grandparents, and these exposures are transmitted to their children and grandchildren. So thank you very much for this very, very important question.
Sí, yo
Alexandra, ¿me
quisiera, no fue claro.
Esto me parece, muchas gracias, me parece muy importante si tú pudieras hacer un pequeño resumen en español dijéramos, de la presentación fundamental de la doctora, porque es probable que muchos de nuestros estudiantes no hayan logrado captar la plenitud del mensaje y tú de pronto con un pequeño, es un abstract, pero en español para todos nosotros, ¿sí?
Bueno, pues la idea es también que empecemos a tener más actividades en inglés.
Por supuesto.
En el club de revistas y en nuestras actividades de las líneas para que nos vamos moviendo en otros idiomas, incluso pudiéramos portugués o otras cosas. Bueno, en resumen, en el primer estudio, que es un estudio de cohorte, ella nos mostró la descripción general de la población que tenían y nos mostró que hay una disminución de la variable de discriminación al incrementar la edad y que hay mayor efecto de la discriminación en aquellas personas que, a pesar del nivel educativo que tuvieran bajo nivel económico, bajos ingresos, ¿cierto? Eso fue, en resumen, en el primer estudio. Y en el segundo estudio, que es el que estamos en Colombia, nos mostró que no tener violencia, ninguna forma de violencia, es como la referencia, pero comparado con los que tienen una forma de violencia, les incrementa el 25% los síntomas depresivos, y cuando tienen 2 o más formas de violencia, duplica el riesgo de tener síntomas depresivos. Y también nos mostró que las mujeres tienen más riesgo que las mujeres tienen más riesgo de los hombres a tener síntomas depresivos. También nos mostró que no hay interacción entre violencia y género, porque hay una prueba estadística para la interacción, y eso en Colombia, Brasil y Alemania, en el segundo estudio de cohorte. Y una aclaracióncita, para nosotros la discriminación es una forma de violencia estructural, por si alguien tiene esa pregunta.
Muchas gracias, muy amable.
Bueno, hay una pregunta en el chat. Sí, una pregunta de Paula que nos dice, tengo una pregunta, ¿hay diferencia entre el efecto de la violencia crónica y aguda? Esa es la primera pregunta.
¿Podrías repetir, Alexa?
Is there a difference between the effect that have the chronic violence and the acute forms of violence?
It's a very good question again, and maybe it's not so easy to answer because it depends on the specific type of the acute violence and the specific type of the chronic violence. So we have to measure the severities. Let's say if it's a very severe case of acute violence, such as sexual violence or gender-based violence, it has an acute impact, even if it's only one time of exposure. And on the other hand, the chronic exposures have an impact according to the duration, whether it's about decades, and then it might be cumulative. But it is related to frequency and intensity.
Ya, pudiera agregar a esta respuesta que en general uno mide la violencia con la intensidad, porque puede que sea solo un episodio, pero es tan intenso el episodio de violencia que tiene una huella para siempre en la vida de la persona. Y puede ser poca intensidad, pero por mucho tiempo, y eso igual tiene mucho efecto. Entonces uno puede medir diferentes formas, pero tienen efectos en salud mental y en diferentes cosas. Y la otra pregunta que hace la profesora Paula es, it is possible that violence produce or imprint in the epigenetics?
Yes, a very good question, and we have some studies showing that indeed there might be opportunities for epigenetic changes. But the good message, of course, is that epigenetics means that genetics can be changed to the better and to the worse. So there are effects of violence, but nevertheless, by providing attachment and bonding and helpful interventions, these effects might be reversed. So really, it depends on the exposure, whether the exposure to violence is a continuous one or whether there are possibilities to counteract the effects of the exposure. So epigenetics always means it's not something which is it is something which is related to probability. So it changes the probability of showing symptoms, but epigenetic or genetics we are always transformed each day. So even today we had to get up very early. Now we are transformed depending on how nice other people are around us. So it is always changing. It is not that the exposure to violence forever and ever has a huge impact, but there are possibilities to reverse the changes.
Ok, y bueno, hay una pregunta de Astrid. She asked regarding violence that happened through the social media, and it also, she wants to know if there is a relationship between the violence that happen in social media and the effects that have in the people.
Very good question as well. And as far as I know, this is not my specific field of study, but as far as I know, there are heterogeneous results, and some showing that the effects might be obvious, especially in younger children, but on the other hand, exposure to violence in the media is not included in the DSM and in the ECD. So it might be that there are less effects because these effects are not direct effects. But I think the results we have so far, they are not the final ones. So we need more studies about this question.
Ok. Y ya creo que es como una reflexión de la pobre profesora Paula, con la que pues quisiera terminar la discusión porque ya se nos pasó, que ella quiere preguntarnos si es posible tener sociedades sin violencia y que si es posible como soñar con ese mundo sin violencia. Entonces, cualquier comentario adicional y cerramos la discusión y disculpen todos los problemas técnicos. No sé si algún comentario más.
Profe Alexandra, ¿me escucha?
Sí, señor.
You can hear me.
Yes,
Yeah, I can
perfectly
hear.
well.
Thanks for your presentation. Very interesting. Technical problem were a small part, no problem with this. I have a question. In the study in Brazil, Germany, and Colombia, who was the data collection process? Thank you.
Okay. Jutta, do you got that?
I
You got
not,
it?
maybe you can
Okay.
answer for Colombia and I will answer for Germany.
Pues es un estudio longitudinal. En general recogimos la mitad de los picos de pandemia en el 2021, la primera medición en ambos países, y luego estamos recogiendo después de eso, a los 3, 6 y 12 meses, información de los trabajadores de la salud. En Colombia nos estamos enfocando en Medellín, Bogotá, Cali y 12 municipios post-conflicto. La recolección es online y basada en las listas que nos proveen las instituciones de salud de sus trabajadores para evitar sesgos de selección. Eso es más o menos. Brasil está recogiendo información solamente de una región que es más o menos como una ría de nosotros, que comprende el hospital grande y los hospitales pequeños, y se está enfocando más en trabajadores de la salud comunitarios. Entonces, pero ellos también conocen muy bien su marco muestral y están siguiendo la población muy bien. And Germany, can you explain Germany sample process?
Sí, y en Alemania nosotros hemos corriendo los datos en toda la Alemania y preferentemente en los hospitales, ya que no tenemos puestos de salud pública, por eso los participantes vienen de los hospitales. we made like a random sample of all major cities in Germany, and it is a double-stage cluster random sampling process, which we have done. We have selected all the hospitals in the major cities, and within the hospitals, we made of these hospitals a random sample. So it's a cluster-based random sampling process.
Profesora Yuta, muchas gracias. Bienvenida a la Universidad de Antioquia.
Muchas gracias.
Ok, profe Carlos, entonces cerramos.
Sí, ya son las 8:07. Ya, bueno, reiterarle la gentileza y la generosidad y el agradecimiento a Yutra por esta presentación. Pedirle excusas pues por las dificultades que tuvimos. Esta es nuestra primera presentación de este año, entonces estamos un poquito oxidados, estamos apenas arrancando otra vez, pero bueno, creo que salió todo muy bien y los mensajes fueron muy claros y quedamos muy motivados. Y profe Alexandra, muchas gracias por la invitación. Pues me parece también muy importante que nuestros estudiantes también se expongan a estas presentaciones en otros idiomas, pues porque digamos que en epidemiología esto es muy importante. Bueno, agradecerles a todos por la participación, recordarles que en el chat está el enlace para registrar la asistencia y la próxima semana tenemos ya programado, ya inicia la programación regular con estudiantes y profesores. Entonces nos vemos aquí próximo miércoles a las 7 de la mañana. Tengan buen día, hasta luego. Chao.
Muchas gracias.
Gracias.
Gracias a ustedes, chao. Muy amable.